Most of the time they are telling ki we are very young, we don't have any problem and all. So why we have suffering with the infertility? So pregnancy is not about only the female factor, it's about the male factor also. I feel if you are below 30, you should have a lot of options to try. But there is a red flags. So better we have to pull them, we have to tell them better to take a step ahead for the IVF.
Hello, Namaskara, Bengaluru. Hope you all are doing great. So, today we have with us Dr. Shyam Gupta, Center Head at Indira IVF, Business Head at Indira IVF South Zone, with 12 plus year of experiences and 100 plus cases, and awarded National Fertility Award, Best IVF Specialist South, contributed more than 16 publications, and the list goes on. So today it's time to welcome him. So, sir, welcome to the show.
Thank you, Kabyasri, to having me here.
Hope you're doing great.
Yeah, so today I'm feel very excited with you.
Yes,
Yeah.
of course. Same to me. And hello, and a very warm welcome to our audience as well. So, hope you are listening to this, and welcome to Khushkhabri Ka Mantra. So, we are always here to guide you all. And if you are listening to this, you or your loved ones are in the path of the parenthood. This journey is always stressed, confusing, and isolating. The path which always be with lot of questions than answers. So, where do we even start? Is a question where all the couples have, is a thought have. So, what do you think about this?
So nowadays, what we are finding is that a lot of couple has a lot of questions, and in the era of artificial intelligence, they
Yeah,
have tons of questions loaded with them, and most of the questions are unsolved also because they need a good answer for those questions.
right.
So whenever the patients are coming to us with a lot of queries and all, every day we are facing the problems. Most of the time they are telling ki we are very young, we don't have any problem and all. So why we have suffering with the infertility? Why we are not able to get the, I mean, we are very young.
Yeah,
So sometimes what happen, age is just a number, just a game. But
correct.
most of the time we have to understand if you are healthy, fit, fine, doesn't mean you have fertility. In terms of fertility, you are absolutely normal. You should be healthy in a lot of terms. And these are the things like the PCOD, like the endometriosis. These things are we are finding in the very, very young population also. So those questions to be addressed very importantly according to their age, according to their understanding, the sociocultures. So a lot of things we have to consider before giving the explanation to the patient. Yeah.
So, doctor, actually, in a lot of couple, there is a fear of blame, and it's one person's fault.
Mhm.
So that makes people walk into the hospital. So, in our first conversation now, what are we actually trying to understand?
First conversations, I would say, is very, very important because first conversations is the conversation where we have to build the relationship, build the trust. The conversation should be such a way that the patient feel that their problem is going to be heard by the doctors. And as a doctors, I have to address everything, not only the problem, the reason behind the problem. As in our social structure, we are most of the time blaming ourselves also, and most of the time blame goes to the female also. So we have to stratify why this blame is coming, why those negative thoughts are coming in their mind. Treatment comes later on, but good counseling, good understanding, this build a relationship, and they are open up with you a lot of things. And when the patients are opening up with a lot of questions and all, so it is much easy for a doctor to treat also. So very important is the conversations is the cornerstone of the one and any treatment. And most of the time, if the patients are very happy, they convince the things. So I think the half of the my job is done. So
Yeah.
if they are stress free with the conversations and all the understanding, then my treatment will be much easy for.
Absolutely. So the next question is like it's a $1 million question
Mhm.
where when actually the IVF procedure should start, because lot of understanding, lot of family issues and all, and lot of internet have so many solutions
Yes,
and all.
yes.
So in that case, when actually the IVF procedure should start, and when they are going to IVF before they start any other remedies, because IVF is not the starting also, there are a lot of other remedies to try. So is it considered to be a failure when we start an IVF?
Because if you see the long 40, 50 years back, how the IVF has evolved, how what in what condition IVF was done. So basically, we have to understand IVF is a process where we are fertilizing. Means
Got
in naturally the fertilization is going to happen in the tube. So we are doing the tube work in the lab. So any couple having the tubal problem should opt IVF as a first choice.
Yeah.
But before that, we never suggest anybody to go and jump for the IVF and all, because before that there are a lot of procedures. You can try naturally. You can try with the IUI.
Yeah.
You can try with the medicines, and you can try with the time things, intercourse, and all those. A lot of procedures are there to try. But
Definitely.
important is that her age, female age, is very very important. As the female age goes up, everybody knows the number of eggs has limited. It is coming down. Not only that, the quality of eggs is also coming down. So very important when to switch to the IVF is important than going jump to the IVF. The switching is very important, because I feel if you are below 30, you should have a lot of option to try. 30 to 35 is always a gray area, and after 35 one should have to be little aggressive for the pregnancy and all. But other important parameter is that what are the other factors, because for any pregnancy we want four factors, like the good womb, good uterus, healthy fallopian tube, healthy eggs, and healthy sperms. So pregnancy is not about only the female factor, it's about the male factor also.
Yeah.
If male has a very very less count, they are not able to conceive naturally, they should have to go for the advanced IVF process, that is called ICSI process. So there are the lot of things made for the different categories. So we have to categorize, we have to switch the things. And but what happened most of the time, people trying other health procedures, and they spend a lot of time in that. And what happened at the end, they're only having the guilt and all. So my concerns is that if I'm able to give anybody baby 6 months early, then they have a equal opportunity in the future to stay 6 months more. So it is always a very very important decisions, and these decisions to be taken together. It's not only the doctor's decisions. So
Yes.
this is a couple problem. It's not a female problem. It's not a main problem. It is a couple problem, and we are as a doctor, I have to get the partner with them, and their journey should be partner with me. I always want walk with me, understand the things, because your stress level will come down, and you can take a beautiful decision when to switch from other procedure to the IVF and get the babies as desired time, because you have a lot of things to plan in the future.
Yeah, so absolutely. So the next question is always like in a couple, what are those red flags to be considered? This is not the time to wait. So we have this is not a time to wait. We have to go for it. So what is those red flag you can tell
So
us?
there are the several red flags, I would say, in terms of female, in terms of male. If I start with the female red flags and all, when female age is more than 35, I would say it's a one of the red flag. Secondly, when they are not able to conceive after the everything is fine, something like unexplained infertility, everything is fine, but still after a year, more than a year of try, they are not able to conceive, then they should have to consult the doctors to find the other reasons. And if there are the multiple reasons, then that is also become one of the other red flags. Another issue is that the tube, when the tube is totally blocked, and tube is such a structure, such a small, such a pampered, such a soft structure, if it's damaged, it will never be getting repaired as it original. So if tube is basically is damaged, and this, and you know the tube work to fertilize egg and sperm. First step is the fertilization, making a baby. If baby is not forming, how they conceive?
So you're saying when the tube is blocked
Block.
and it's not recovered like
Yes.
normal, it
So
can't be normal.
this is one of the biggest red flag to go for IVF.
Yeah. Okay.
Right, not only that, when if anybody has any comorbidity, somebody is very obese, somebody has a diabetic, somebody has hypertension, they should have to take the early, I mean, consultation with the doctors, because these are also the red flags. In the future it will come, it will getting a difficult for during the pregnancy also. And if you talk to the men's parameters and all, and those men's who have a no sperms, that is called agiospermia, those who have a very very bad sperms, maybe the severe oligosteatoteratogeospermia, where the motility is almost nil. Morphology means quality of sperm is always, also bad. So they have to be. These are the red flags. They have to think about the alternative procedure where they get the success high.
So it's a strategic action, not just a hope.
Yes, yes, absolutely. It should be very studied. It should something like a calculations. It's
Yeah.
just like a mathematics, 1 plus 1 2. That's why we have to calculate in that way. so whether this person needs IVF or not. It's not about to jump to IVF. It's not about pull everybody to IVF.
So doctor, so as you told, it's not just about age also, but about our modern life. So our Karnataka is having a lot of its own health issues. In particular communities, they have some issues, and mining areas they have some health issues. Will that impact for the fertility or the pregnancy ratio?
I would say definitely yes, but we have to understand ki what type of the occupations they have first things. And as you mentioned, the Bangalore and the Bangalorean job, and
Yeah.
you know there is always in the Bangalore. Whenever you think about Bangalore, it comes to the IT factors. So you know the IT people, IT factors. I'm not telling IT as a bad sector, but important is that they have a very long sitting hours. They have a very stressful work, and maybe they have a night shifts and all. They are not able to take care of themselves. They don't able to take the proper rest. They are not able to focus on their health. So these are also one of the very important factors. As you mentioned, the mining areas and all. So you know those areas are also stressful environments and all, right? Because occupations definitely there. If somebody has working a lot of heat environments, lot of the closed space where the sunlight is not reaching over there, so there is always chances of sperm to be get disturbed. Not only that, the female which were under the very stressful working environments, work cultures, which we are mostly finding in the IT sectors and all. So their period has also become irregular. That the quality of health is also become poor. So absolutely, occupations, the way we are living in the Bangalore, the way Bangalore is modifying. Not even that, there are a lot of factors. Along with that, even your fooding habits, even your water level, everything's matter for being a healthy and being a good health and being a healthy fertility also.
So, okay, what about diet? Because our cuisine is diverse from Bisabelabat to local seafood or something. So, will that impact that's local dietary habit? How it get impact?
Look, if you see the cultures, our cultures, as you mentioned, our cultures is a very beautifully balanced diet first,
Yeah,
right? But our culture, there are a lot of carbohydrate also. Because we should have to balance the diet. We should have the some portion of carbohydrate, some portion of protein, some portion of fat. If you go in the more of the carbohydrate, there is chances of that insulin resistance, and this is one of the factor what we found in the young female to having the PCOD also. So but those things we have to take very good portions, balance the diets in the different ways. And if you are taking the healthy diets, and hydration is very important, so you are
definitely.
taking the lot of water, and you are focus on a lot of citrus type of the fruit, infuser waters and all. So that definitely heal your body, and those things. But culturally our foods are very good, but we have to control the portion of the carbohydrate.
So,
This is
is
what I
there
can
any
say.
specific food habits which should avoid or something?
Mostly, as a working professionals, a lot of people I have seen, they're in the lunch hour, they are taking a lot of things in the outside food. They are mostly on the snacks, they are mostly on the packed foods, they are mostly on the very sugary drinks and all. So those things are definitely is important to avoid, because those things is not going to give you a better health profile and all.
So, when a couple is struggling, their mind straight away goes to IVF. So, but you are offering a lot of other varieties of treatments. So, if you can explain us what are the steps before an IVF, and for example, what is lapography and how it's gonna be helpful for the natural conception.
So it's a very big discussion should go for this, because
Okay.
and if the patient come in to our hospitals with any type of the problems, the problem is only they want baby.
Yeah.
They don't want what technology I'm using. They don't want what I'm doing. They want baby. This is what they're understanding when you discuss with them. And most of the time, they've gone through a lot of local doctors and all. They have some sort of knowledge and all, and they do the Google. They do the the AI make platforms and they gather a lot of
Yeah.
informations. So very important is the personalized understanding. It is not about to put everyone in the same blanket. So important is to take the all the necessary test, which I can consider as a very important to understand their body profile. What is their egg counts? How is their scans? How is their semen parameters? Is there any other hormonal issues are there or not? So we have to make a very personalized investigations for them. Once the investigations has happened, then we have to focus on what type of the problem in the investigation and where they stand today in terms of age, in terms of the background, not only the job and occupations background, we have to see the family background also,
Yeah.
because the lot of time the people has the very much stress coming from the family oriented, and maybe the sometime we can tell it as from the in-laws side also. So you have to understand overall ki what how much pressure they have. So we have to not only treat medically, we have to treat emotionally also, because whenever two people are coming to my chamber, I feel there are the four people behind them standing and waiting for the baby. So we
Right.
have to address not only them, we have to address their parents, their in-laws, everybody we have to address. So you have to understand ki which category this person is going to fit. If they are the perfectly category, because we have a lot of protocols, and any protocols in the world to set, it takes years and years of rigorous exercise and research. It is not made in one day. So somebody has done so much of exercise in the making of protocols, and we are using the protocols to ease the patients in, I mean, work and all patients. So protocol, if the protocol saying, this is a candidate where you can fit in the natural pregnancy, we should definitely encourage them for the natural pregnancies. But if the protocol says no, it is better to go for IUI, intrauterine insemination, which is also a very simple process, and that also increases some success and all. So we have to think about, we have to counsel in that. But there is a red flags, many red flags. So better we have to pull them, we have to tell them better to take a step ahead for the IVF, and save your precious time and precious most of it. After that we can focus in your work, you can focus on your career also. So it is not only the one parameters, we have to see multiple parameters to make the guide them in the proper medical treatment and all.
So you're saying IVF is for little severe cases, and we have a lot of other treatment for the less severe cases,
Yes.
right? So we have been talking about all this procedure, but I just want to understand. I have seen if we go to a one real incident, will our audience also will be easy to understand the procedure. I have seen a couple who was struggling to have their own baby, and they had two miscarriages, and later they went for an IVF, and they were having their own baby, and they were very happy. And I know the struggle, how they were having so much struggle, so much that's so disheartening, right? So you will be going through a lot of couples, you will be seeing a lot of couples every day. So to give us one or two cases, if you can give us so that it will be encouraging for other couples to come for this procedures.
Since I have done thousands of cases in my life, so I have a lot of millions of, I would say, the stories I have. But some stories really touch me.
Yeah.
As you mentioned, the miscarriages and all, and this is a not. Sometimes I would say it's a very common nowadays. We are seeing in a lot of alternate patients having one or two miscarriages coming to our clinic for the and any type of the fertility treatment. If I remember one person recently come from West Bengal, she is very young person of 24, 25 years, and unfortunately she has 8 miscarriages,
Oh.
and each and every miscarriages, I think female can only understand how much, I mean, that trouble and how much she's, I mean, depressed during those procedure and all, those miscarriages and all. So that only that female can understand that scenario. We can only vibes. But those eight miscarriages, then they came for the IVF and all. So they told, "Ki, sir, I want IVF." But I asked, why you want to IVF? Because if I IVF, I am using your egg and sperm, same thing.
Yeah.
So again, it can went into the miscarriages. There is always a possibilities. So why not we explore, dive inside more, and we understand why these things are happening. So one that we comes to know that there are some problem in their genetic profiles and all. So finally, I have to do IVF for them. Then I have to check the embryos for genetic testing. That is called PGTA,
Okay.
pre-implantation genetic testing for aneuploidy. So it gives me healthy embryos. So that embryos I transfer one embryos in that female, she conceived, and she is almost currently 7 8 month of pregnancy. So this is how we can see. And one ironically, one more cases, such cases I came. She's very young lady, around 30 35 years, and she's nearby in the Indira Nagar, I think so. Still, I remember she has a 4 miscarriages at 9 10 weeks after the heartbeat, and baby has a heartbeat and all. And every miscarriage is after 9 weeks. It is very surprise for us, and she underwent some test to the babies also.
Okay.
So that also turns to be normal.
Okay.
So then we thought, what is the other conditions? Again, we'll deep dive into that. So we go through some immunological test and all. So we found some immunological condition in her. We treated those immunological conditions. And somehow I told ki wait for this cycle, try naturally. If not, and we'll do the IVF in next month. And with the God grace, he conceived naturally again. It's a fifth pregnancy, and that pregnancy went very well. She delivered also. Today she is very happy and she's planning for second baby also. So this is how it's not always the IVF. These two cases tells us ki we have to understand why the miscarriage happen. As you mentioned, there is a two miscarriages, and everybody has right to have their own biological child. Nothing about
Yes.
the donor and all. Everybody is right, and we have to encourage them for their own biological child. But if you understand the current scenario, if you understand the reason, it is much easy, and it is very easy to treat the reason and give their own biological child.
So this is so inspiring and powerful story. I hope for our audience also it might be inspiring. And so if you like this story and if you get inspired, please share it with your friends. And one more question. It's kind of a rapid fire. So we'll be having some questions. So the first question is IVF painful?
This is a very common question we are getting every day because people are scared. Definitely, this is a very out of, they don't never understand the what is IVF going through, and in one language, it is not painful, and it is very very safe also in expertise hands.
So, after an IVF for the first baby, for if they're planning for the second baby, will that be a normal? Is it there is a chance or not?
There are several story with me. After the first IVF baby, they conceived naturally for the second baby. Still, I have an embryo left in my lab. So those who are coming to our clinic in Indira IVF after the first baby, and if you see the parameters are earlier very normal,
Hmm.
we always encourage them to try naturally for 6 to 1 years. If not, then we have embryo left in my lab. We can transfer those embryos. So this is how we are doing for the patients, and we have several hundreds of stories. We have they conceive second baby naturally, and they are very very happy for that.
Because a lot of couples, they would have waited for 4 5 years, but once they step into the hospital, so they wanted immediately. I can't wait for the normal. I've been waiting for long, and at that time, what do you suggest?
No, first I as a being very ethical person in the medical field, I always wanted to find the reason to do the IVF. It is not that patient wish. We always wanted to what is the reason for IVF and all. So if the patient fit in our reasons, if our protocols, then we always encourage them to do the IVF. But sometimes we have to listen the patient also because their pressure, the social pressure, they only bear. We can medically we cannot understand. So if they have a lot of pressure, they want to save the time, then IVF is a solution for them also.
So, what is the success rate for the people who is under 35 age?
There is very common proverb is there, and IVF is also much successful when you are young. So most of the time, 30 below 30 people are not landing to the IVF most of the time until unless they have a very, 3 4 red flags and all what you can say. So in those conditions, when people are below 30, they have a very good number of eggs. First thing, they have a healthy all the parameters. The health is also healthy in terms of the hormones, in terms of the heart, in terms of the other features and all, and their eggs are also healthy, and we are able to make the good embryos. And when the good embryos, blastocyst is there, blastocyst is the name of the embryos, which is a day 5 day 6 embryos. If we have a high quality embryos, success goes up to 80 85%.
So, what do you think? What is the age where the IVF and all this can work for the ladies?
If you precisely see the age only, I would say after 35 once you have to consider, because if you delay for the first baby, you don't have a much enthusiasm to get a second baby also. Medical science also tells at least you get the first baby by 30th, second baby by 35. If you
Yeah.
are delaying for the first baby, when you get the second baby, you'll get the exhausted, because you have a career ahead. You have a then and you need a 2 3 years, 3 years definitely after the baby born. You need 3 years to take care of baby also, because
Yeah.
you cannot leave the baby and go to the work all the time.
Yes.
So a lot of things parameters. So only the age means you have plan the things very nicely, because today's the world is all about planning, and there are a lot of system we can give you a good understanding how to plan your life. So plan your baby at what age you want baby. Once you desire, no, I'm a 30, I want a baby, you should have baby in hand in 1 year.
Yeah.
If you're delaying that, so better to take help from the experts and all. Discuss the queries with the experts. Experts are there to help you in all 360.
So, does Bangalore traffic affect fertility?
Definitely there is no, can't say no, because Bangalore traffic is the one of the mystery which is not going to solve. I don't think when it is going to be a ease for us. But the traffic, we have to commute every day. We have to go to the work. We have to come back to home. But we are sitting in the traffic. We are spending so much of the time in the traffic, stressing our body, and I feel we are cutting short our own time, me time, I would say, because we don't have a time for the exercise. We don't have a time to take a proper rest because we have to rush to the work because traffic is going to take 2 hours. So you have to be early on the bed and early to start from your home because you have to reach the office on time. So this hassles giving you a lot of stress. Even you are not remember to take a water, your hydration level goes down. You're sitting constantly sitting can increase the temperature of your body, and if you increase the temperature, even the sperm counts is getting worse. So a lot of things are hands on hands going on. So traffic is definitely the pollutions. These are definitely affecting the stress during the driving and during the work stress. They are also affecting parallelly. So we should have to take some solutions how to ease the traffic because this is definitely ruining our health in many ways.
So, to understand what's exciting in fertility tech.
So in technology of fertility, there are a lot of things has been introduced in last 5 years, and I am very much excited for the artificial intelligence. I am also inside this very much. So today we have some artificial intelligence system where we can select the good embryos, because that system will take a picture of the embryos, and that pictures will be getting verified with the thousands of pictures in the backgrounds which human eye cannot process, but AI can process, and they'll give current picture whatever I have loaded, whatever current images of this embryo. It is it has a high success or not, how much the success for the pregnancy, how much the success for the live birth. So everything they can calculate and give it out in a score which is equivalent to our success and all.
Okay.
So this is one technology which is coming, and there are a lot of technology we have adopted in our lab. Like one technology is the RI witnessing system. So you must have heard about in the IVF there is chances of mixing and all. So
Yeah.
these are the system. RI witnessing system is one of the cloud-based system, and each and every I can say the discs where we keep the eggs and I mean this all labeled with the barcodes. So when you put the discs on the particular plate and all, the we have a three four, I mean the displays, and every display tells the patient name with all identity. So it never be if they are not matching and all, they not allow us to do the further work, and it are all very much cloud based. Nobody can manipulate also. So this is how we technology can help the safety to the clinicians also, and safety to the patient. They can blindly trust that this is not going to happen, because these are the witnessing system, electronic witnessing system and all. Apart from that there are a lot of technologies in the machines also itself have developed, so it will become more easy for the embryologist to work, and we get the higher success and all. We have one technology, something called as a closed working chamber, where we create inside the environment something like a same what we create is present in our womb. So what the womb has some oxygen level, some carbon, some temperature. We
Right.
create the similar things in the lab. So this is also one of the very technology where we simulate when the egg and egg sperm is coming from the body, they feel they are still in the body only. So their quality, their potency is not going to decrease, and they give a higher success and all.
So, I think a lot of people will be having this question: what's the actual cost for IVF procedure?
Yeah, definitely cost is a very very important factor,
Yes.
because everybody has to be plan their cost, because they have a not only the IVF, they have a lot of cost behind the life.
Yes.
So, and the more important is the transparency. For any clinic should be very, very, very much transparent about the cost. And as Indira IVF, what we always wanted to give the full cost, including the medicines, including the other new technologies and all, the freezing, the laser hatching, the blastocyst culture, and integration with the AI and all. So we'll give one package so that patients should not feel stress for the small hidden cost and all. So whatever cost we design, है ना, so with that design that as for example, if I say our one cycle cost is 1.95 and two cycle is 2.75, that includes everything, even the stimulation injections, even lot of procedures which give higher success, because success is not only the patient desire, it's our desire also. One IVF failure hurt us also, it is not about the patient.
Right.
So we are also working in such a way that we give our full, so that patients should not suffer, should not. So cost part is one of the stressful, because If a lot of hidden cost will come, person get stressed, and there is chances my outcome also hamper. So we be very ethical. We wanted to tell, as in kit, and this is the cost. If any queries and all, please talk to us. We are here, but sometime the cost cannot be fixed. Somebody needs some genetic testing, somebody needs some sort of immunological test and treatment, and somebody needs some sort of extra medicines. Somebody has a bleeding in between, we have to add some medicines. So medicine cost will be little bit different, but overall IVF cost, we are very, very transparent. As Indira IVF, we wanted to give the best of their.
So as we all know, IVF not is not the only procedure. We have IUI also. So what is the success rate between IVF and IUI?
It's a big difference. We cannot compare the IUI with the, IVF success, because as I mentioned, in the natural pregnancy, we want the healthy tube to fertilize. In IUI also, we want healthy tube to fertilize. Only thing is that in natural pregnancy, when they are staying together, the sperm is spilling in the outside. In IUI and all, we collect the sperms on particular time. We wash the sperms, and the very, very good sperm we put inside the uterus. But tube is the same, so they have to fertilize. If they are fertilizing, means the success rate goes up. So as per the data and all, if I talk about data, the IUI natural pregnancy success we usually mention 8 to 10%, and IUI goes up to 12 to 15%. So this is a difference, but where the IVF stand, the success goes up to 70-75% minimum, because those things, the tube work we are doing in the lab under our vision, because inside uterus nobody can see. If I'm not able to see, how can I explain the things what is going on? Only I can make a story, which is not true. We have to
Yeah.
be very precise as a medical science. So when you see the things in the in our lab and all, we can understand what type of the quality the person is giving the egg and sperm. If the egg and sperms are meeting, means fertilizing, whether they are able to develop the baby or not. That is also one conditions. Because every day, suppose just for
Yeah,
example, every day you are cooking food, the food cannot be the same taste, the same food.
of course.
So every cycle, the egg and sperms are meeting and making a baby, and all babies are different. Even my siblings, your siblings are different. Father, mother is same. They cannot make a clone,
Right.
right? So
Right.
those things we have to understand whether those, the embryo and egg and embryo. Sometimes what happen, IVF is also become a test of fertility, because we have not done the test where I can take a sperm, I can take a egg and make and fertilize and see. So IVF is the process which gives up why the really the patient is not having a baby. So a lot of things are there, but in IUI, a lot of things are still under the cover, under the hidden. So a lot of explanation cannot be given. So that's why the success goes up to 10 to 15%.
So IUI is like almost like a normal
Thank you.
thing only, but IVF you will have a lot of things to do,
Yes.
so that the success rate is
Success
a
is
little
goes up.
high.
Yes.
Okay, but lot of people have this concern because people think if we are doing IVF, there will be a lot of birth defect. So is that true?
Look, birth defect, if I say there is the defects, lot of defects are noted in the natural pregnancy also. Before the IVF established in 1979, the first IVF baby was born in 1978, the Louis Brown. Before that also people has a lot of birth defects. IVF cannot say it is going to increase the birth defects, but birth defects can possible in any process of IVF also and natural pregnancy also. So one should not be very scared that IVF is going to increase the birth defects, and baby has some, abnormality. And we have thousands and thousands of pregnancy stories. Recently, we celebrated 1,75,000 pregnancy stories and all. And touchwood, we found each and every babies are healthy. So it's not about, and IVF babies are also doing very good in the, because this is almost a 40 years, 45 years back the IVF started.
Yes.
So those things, I would say IVF babies are also equally, they are doing the good as the normal babies and all. IVF is just a process of fertilizations. Rest everything is happening naturally. So process of fertilizations, we cannot say all the time it is a error and all. So birth defect will increase, we cannot say. But for that, we have a lot of step to analyze whether this birth defect is there or not. We can detect the defect very early, and we can treat according to that.
Okay. So when IVF cycle fails, what next?
This is everyone's questions, sir. This fails, what to do? Because somebody has a lot of failure outside also, they come to us and they are telling us that this is my last cycle. So this is become a pressure for us, but absolutely very nice question. First cycle, I would say always, if fails, that gives you a lot of informations. What we have done in the past, that information is very, very important to customize your second cycle. And first cycle sometimes is eye opening also. What you have not done can be done in the second cycle, can make more personalized IVF care and all. But failure is not only the embryo story, not only the patient. There are a lot of things in the background where the implantations, when I put the embryo inside the uterus, it has to implant. The implantations mechanism is very, very, I would say it's still people are understanding. It is less understood. So that is the point where IVF cannot be 100%. Otherwise, one can give us 100% guarantee. We cannot give a guarantee because implantation is no one's hand. Simple example, if I say, if you throw 100 seeds in a field, 100 plants cannot be formed. So like this, if I putting an embryo in the, because embryo is a seed and the uterus is the land. So if you put the seed, there is chance it can implant, it can grow, it cannot grow. So there are several factors we have to see. One failure doesn't mean there are a lot of stories they can success in second attempt and third attempt. It is not that one failure is the one stop. So we have to understand, we have to take the information of the first cycles, what in things we have to modify, because there are a lot of areas we cannot ask to do the person at the first time because their cost goes very high.
Yeah.
So we have to balancing their things. We have to understand what 90% people behave. 10% is always differently behaving. So in those conditions, we have to go for a very, very deep into the immunogenetics. We have to go deep into the, lot of test and all. We have to understand the implantation window. We have to understand a lot of such aspects so that the success can be increased.
So if the first cycle get fails for in an IUI or IVF, so when they're trying for the second one, so is there any success rate difference?
Yes, of course, there is a beautiful data also published by the Royal College of Obs and Gynae UK people. They have given as per the age and as per the number of attempts, what is the success goes up. If your age is less than 30-35, and if your first attempt success is almost 80%, 75-80%, second goes up to 80-85%,
Okay.
and third goes to 85, more than 85, 90, 92%, up to 92% they have mentioned. So something like in statics, you must have heard about the cumulative success, add-on success. First cycle success, if it is a 70-75%, the two cycles definitely increase the success, three cycle definitely increase the success.
So when we are going for IVF, so from starting consultation to the procedure, how much time it takes?
So basically, we always say it is a two cycle process because we always believe in the standard cycles. Standard means as per the protocols, as per the guidelines, what the world are doing, what the research tell us. So first cycle, we always focus on to take the good quality of eggs and good quality of sperms and make a baby. Once the baby is formed, we freeze the baby, and in the second cycle, we thaw the baby. Thaw means we live the baby and transfer in that. So it is a two cycle process. Technically, it takes around in 2 months' time. She can able to see the as I heard beta. Pregnancy is positive or not. We call it as a beta SCG test.
Okay.
So that test at the end of the 2 month, I think one can do and see whether the pregnancy. And there is one process called as the fresh transfer. In the same cycle, we can do the embryo transfer also. But fresh transfer cycles, the success is almost 30-35%, not more than that. The frozen embryo transfer, if I freeze the embryo, transfer in the next cycle, the success goes up to 80-85%. So that's why we need a two cycle process.
Okay. So does hospitalization is required after ET?
Absolutely no, because this IVF process is very much daycare process. So they don't need to hospitalize for any procedures for any instance of the treatment process. They have to come and go. And these are the very, very quick process. Even I would say ki one egg retrieval, the egg harvesting, it takes 5 to 10 minutes, and patient can go home in another 2 to 3 hours. Even embryo transfer technically takes 2 minutes, and it is very it's non-painful. No need of anesthesia, no need of any hospitalization. They can go in 1 hour. So these are the very quick, very safe, painless techniques. Some discomfort will be there, but that is not worth than the achieving the result. Yeah.
So in a month, actually, when a couple is trying to conceive, so when actually the perfect time to conceive, and if you can give us one small idea for our listeners.
So for natural try, if anybody is looking for a natural try, we always suggest if people like if the female has a very, very regular cycle itself says that she has a very good ovulation. She is ovulating her egg on time. If that is there, then they can try naturally from day 18 to day 11 to day 18. This is a perfect time to natural try. They can stay together for relationship at least alternate day, so that they can have achieved the good success. This is for the natural try. In IUI and all, we have to monitor the follicles. Follicle has to reach some certain size, that is called 18, more than 18 mm. If follicle means egg follicles, if reach 18 mm, we consider it as a mature follicles, means good number, good eggs. So that, then we have to give some injections which rupture that, and once the rupture, we believe that egg will come in the tube in 36 hour around. So we do IUI at the 36 hour. So this is how we can increase the success and all.
Yeah. So once couple get married, how long they can wait for the natural one, and then they should go for the hospital?
So that again depends on the age, and if age is less than 30, what protocol says, if less than 35, they can wait up to 1 year natural try. If their age is more than 35, the 1 year shrink to the 6 month.
Okay.
But I believe nowadays time is very important. One can earn money, but one cannot earn time. So better one should have to look for a pre-conceptional counseling also. Means if you are planning for a baby, why not to see for a doctor to understand what problem you have, so that you can save time. That 1 year is also important. If somebody
Yes.
has a sperm zero, for them that 1 year has wasted. So better early treatment, better than early treatment. Early diagnosis is very important to
Yes.
understand your health. That is called as a conceptional counselings and all. Thereafter they can try. But age is very important as for a simple protocols. But there are a lot of factors that decides IVF and other process. Yeah.
Yes. So, doctor, I think when it comes to fertility, when the couple is trying, they firstly go to a lot of babas, Ayurvedic, and we have a lot of options online. So, firstly, they prefer that, and then they think IVF is a last option. And what do you think? Is that okay to do that, or will it be wasting time? What do you say?
So basically, everybody has option to try. We cannot take the humans right. So if they are trying anything and they are happy, I feel that try is good, well enough. But sometimes, some point of time, we need a baby as soon as possible. In those conditions, this looks like a waste of time, because Babajis and all, there is no scientific reason what they are doing. Even with the Ayurveda, we have a good scientific reasons, but we don't have a trials and all how it is going to work. But in sometime in IVF, lot of things has been cleared, lot of things has been come in our hand, and so success will go up. So wasting a time, because money can be, I told last time, last conversation also, कि money we can able to earn, but we cannot earn the time.
Yeah.
So we have to be very precise what treatment is taking your time, what treatment is giving your baby. That is more important to think.
So a lot of fertility center, no, they claim the IVF will cost 25,000, 30,000. We can do it. We have a lot of offers and all going on. So is it possible?
IVF itself a very, I would say कि one of the process where the expense will come. Claiming a very low success might be, there are chances they'll compromise in the treatment protocols. If you see earlier ages, 5-10 years back, IVF were much costlier than today. But as the things advance, as the people are taking several people are taking the treatment, and the demand is there, the cost is also comes down. But 25,000 in IVF is something which is not. It's, I also feel uncomfortable listening this. But yeah, definitely, I know we can match one cost with the patient profile and all. We try to give our best cost to the profile, because there are a lot of injections. Different injections has a different cost. We can adjust the injections so that how the cost will comes down. But if you go for a standard technique and all, the cost will come 25,000. None of those IVF center, even my center, cannot be able to handle the cost. And but if we have to see where the technology is there, when the technology comes in the picture, we have to expend the money for the technology. Earlier we have a simple phone that also is working better, but today we have a very smartphones, very expensive phone.
Yeah.
Still we are working the same thing, conversation and texting. So as the things are getting, and you have the cost is varying according to that. So
Yeah.
cost is a very important factor for every couple, but low cost must be something, some we can doubt on the low cost also.
Yeah, so a lot of fertility centers, and I have seen so many ads claiming for 100% success rate. So, is it even a real instance, or is it possible to give 100% success rate in IVF?
Truly medical science, nothing is 100%. Any person is going to any hospital doesn't guarantee 100% they will cured, but we can give only the 100% commitment of our honesty, our the evidence based treatment protocol, our 100% our effort to give the baby. 100% we can assure them. कि at least we'll with you only, we are stepping with you only, come with us, walk with us in the treatment journey, we are partnering with you. So have 100% confidence in us. But 100% treatment success nobody can give, because implantation is the one area where still research is going on. Nobody understand whether this embryo, the healthy embryo, is going to implant or not. So a lot of things are under the cover, so still we cannot claim as 100% at any moment.
So, doctor, you have been sharing a lot of information with us, and I hope the listeners will be helpful. And one final last message for our listeners.
Thank you. So my dear listeners, I only just give a simple messages. Think about yourself first, think about the work, think about the life. Don't ignore the fertility issues also, because once the time goes up, the time cannot be reverted back. Take the action on time. Those who are very, aggressive in the work, that's good to work, but think about the health, because sometimes you are missing the, links between your health and what you desire. So in the fertility and all, if I precisely talking about the fertility, fertility health is very important along with your general routine health. Age is very important. Take the action on time, and I believe this message is a very strong enough to think once about yourself, how to become healthy in terms of your routine health. Thank you.
So, thank you so much, doctor, for your time and valuable advices. So, to our listeners, thanks for seeing entire video, and hope this is helpful for you. Please share, subscribe, and share it to all your friends and family. And Khushkhabri Ka Mantra is always there to guide you. Thank you.